specialist doctor to take care of your concerns. Every week, we invite an eminent doctor based on your feedbacks, your queries, your suggestions as to what you want to hear from us. And based on that, we invite these doctors from various specialties to answer your queries and answer your concerns. This week, we have invited a very special orthopedic surgeon, Dr. Deepak. He's working as a surgeon, orthopedic surgeon at prestigious Devadas Hospital in Madurai. So Dr. Deepak is going to talk about a very important topic which many people wanted us to answer, which is the role of PRP injections in orthopedics. What is the role of PRP injections in orthopedics? If you have got any questions on this topic, please do not hesitate to ask us in the comment section below, and we will try to take them during this live session. So without taking much time, I'm going to invite Dr. Deepak. He's just going to join us now. Good morning, Dr. Deepak.
Morning.
Thank you so much for joining us.
Thank you.
Great. It's wonderful to have you back with us.
Yeah.
Your sessions are always most cherished by a lot of people, and they're looking up to listening to you and hearing what you have to say next. So, Doctor, so today's topic for us is role of PRP injection in orthopedic. So our listeners want to know. Let's start, with the basics for their questions. What exactly is PRP and how does it work in orthopedics?
Thank you for the invitation. And always we choose a big topic or an interesting topic where people wants to interact and know more about it, and we'll teach them and tell them about the subject and all. So you have chosen the subject that is a PRP injection in orthopedics. So actually the PRP, the long form of the PRP is the platelet-rich plasma. This is a kind of a sort of autologous, means we are taking the blood, venous blood from the patient and centrifuging it so that we will separate the portion of the blood. Actually blood contains what? It contains the water kind of a thing which is called as a plasma, and it contains the cells. The main cells are the RBCs, WBCs and the platelets. So here we are saying RBCs and WBCs. Then the platelets mixed with the, we are injecting into the some of the sites where the patient will have the pain. So actually why we are taking only the platelets means, say platelets has got important role in the body because it helps in the hemostasis. Like whenever there is a bleeding, to stop the bleeding we need a platelets. Whenever there is an infection, we need a immunity or the barrier to fight for the bacteria and all. And whenever there is a tissue healing, like whenever there is a wound is there, for the faster healing we need a platelets. For the bone healing we need a platelets. Some of the ligamentous injuries are there, for that also we need a platelet. And for a growth of a nerves or the blood vessels, angiogenesis what we say, vasculogenesis what we say, for that purpose also we need a platelet. So platelet play an important role in our body, and they contain different kinds of granules. So what is called as alpha granules and the dense granules, which contains the different kinds of growth factors. We name them as a PDGF, EGF, FGF, PGF. There are many kinds of the growth factors are involved in that. Whenever they are activated, they will degranulate, they will release these growth factors and help in the various portions, like whenever there is infection, inflammation, tissue healing, wound healing, many things it will help us. So that is what we are interested in, the platelet, and they are mixed with the plasma where they get activated and we inject into the different portions.
Right. Thank you for sharing that. So PRP basically platelet-rich plasma, guys. All of those who are joining us just now, please do ask your question in the comment section below. We will try to take them up during this live session. I believe a lot of people are already joining in. We would ask everyone, whichever social media you are, Facebook, LinkedIn, YouTube, Twitter. We are live everywhere right now, and you can join from your preferred channel. So, guys, so doctor, coming back to the topic, who are the best candidates for PRP injections? How can someone determine if it's the right choice for them?
See, actually, if you see in our body, we have a lot of problems. Like the many patients suffer with the different problems, such as starting from the head to the toe. If you say the patient has got cervical spondylosis, they have a shoulder pain because of the rotator cuff tear or acromioclavicular joint injuries with the osteoarthritis, and they have a elbow pain because of the tennis elbow. Last week we spoke about that tennis elbow or the golfer's elbow. Then more commonly being the knee pain, which is commonly due to the wear and tear, early degeneration, even with some kind of the ligamentous injuries also. And if you see in the ankle region, patient has got a plantar fasciitis because of every day the patient will have a lot of heel pain. That is because of the various reasons like a plantar fasciitis, calcaneal spur, Achilles adenopathy, tendinopathy will be there. So there are many things are there. If you consider the basic common problem in any of the people is the knee pain. So usually in the age group of 40 to 45 or 50, they come with a knee pain, which is the due to the either earlier wear and tear or early degenerative diseases or some kind of a ligament injury. So what kind of treatment do you give? You give basically the painkillers, some rest, some physiotherapy, some assistive devices like braces or walkers, canes and all, and they ask them to have some rest and all. And in another side, we have if they don't recover with these kind of a treatment, what we suggest undergo a surgery like arthroscopic surgery for the debridement or some kind of a higher surgery like HTO, what we say as a high tibial osteotomy. And in extreme cases, if they are not getting recovered, then we advise them undergo total knee surgery, total knee replacement surgery. So there are the two ends. So one end is the conservative, one end is the surgical part. So where is the exact middle path? Means those patients who are recovering with a conservative and they are fastly progressing to the other end. Where to stop? How to stop them? So the answer is in the nature. See, if you see the aging, if you consider aging is a natural, everyone believes that aging is a natural, and also the nature is the natural healer. What is the fact? Because whenever there is a wound is there, it will heal off. Whenever there is a fracture is there, it will heal off. So how they heal off? Because they heal because of the body's important growth factors. The nature has got some signals, so they will release the signals at the right time, at the right place, so that it will trigger the healing. So in the same kind, this PRP injection works for the patients, those who having these problems in the earlier part. Means they got a shoulder pain, they are not recovered with the painkillers or a steroid injection or a physiotherapy. What's the next treatment? The next treatment is the PRP injection. So this is very simple procedure and patient definitely will get the benefit out of the PRP injection. So the common people what we treat with the PRP are the mainly the early osteoarthritis in the age group of 45 to 60 years, and the tennis elbow, those who are having a lot of elbow pain, or those who are having the shoulder pain because of the rotator cuff tear, or it is because of the OA changes or some of the ligamentous injuries, or it is because of the ankle problems such as a plantar fasciitis or a heel pain. Those who are having a lot of heel pain or the foot pain they are having. So we usually treat these patients with a PRP.
Thank you so much for sharing that, doctor. I'm sure that is a lot of help for a lot of people who want to understand what is platelet-rich plasma and which are the best candidates for that. Now, doctor, can you please share some success stories of patients who have undergone PRP treatments and experienced significant improvements?
So this PRP injection worked very well, especially in the sports individuals. See, if you consider the big names in the sports, such as a Tiger Woods, is a famous golf player. So he had a kind of a knee pain. He has got an ACL injury. He had some ankle problems, which are treated with this PRP injection only. And if you take some other names like the Rahul Nanuhal, who is the tennis player, he also had some kind of a shoulder injury as well as the ACL tear in the knee joint, and he has got a chronic knee pain. They are not able to walk or do the physiotherapy basic activities. So instead of choosing the conservative treatment or going for a surgery, they choose the PRP injection. And this PRP injection with the regular interval of injections, if you give for every month or every 2 months or 3 months, over the period of 1 year, there was excellent healing, and they never underwent a surgery for these problems, and they continued their activities. So if you consider these success stories, so these are the ideal examples how the PRP works. So these are the people who also marketed and they openly said in the newspaper and the news channels that the PRP helped their career and they gave a second chance in the career as well.
Sure. Yeah, all of them are very known names, and we can correlate with that. We have read about that in the newspapers. You're right. So, doctor, for those who might not be familiar, how is PRP made and prepared for injection?
So PRP, as we know, the ideal candidate we have chosen, and it is basically a 10 minutes process. So for this purpose, we usually do it in a OT or in a clean condition or a clean area. So the best part in the hospital is the OT, where we take the patients there and we withdraw 25 ml of the venous blood from the patient, which is the autologous blood. And after taking that into the kit, usually the PRP kit comes into that and it contains anticoagulant so that the blood should not clot and all. So once it is done, then it is placed into a machine called a centrifugal machine. Okay, the machine comes with a smaller size, bigger size and all. And we need to centrifuge it, means we need to rotate it, so that we need to separate the portions, like the liquid part and the cell part, we need to separate it. Once we keep it in the centrifugal machine and runs it for a 3000 or 200 RPM for the 5 minutes, so it gets separated into the liquid part and the solid part. The liquid part is the plasma, the solid part is the RBC, WBCs and the platelets. The platelets usually comes in the upper portion, WBC little low, and the RBCs are the full at the down portion. Then we need to move this, the buffy coat, the platelet move, layer into the plasma. Then we completely lock the RBC and WBC chamber. Then how much the quantity requirement is there, like usually if it is a larger joint, we usually give 4 to 8 ml of the PRP injection. Then we take the plasma of the 8 ml with the platelets into the another chamber. Then we'll lock that kit and again we'll keep it in the centrifugal machine for the 5 minutes. So here in this portion, the platelets get activated once we do that centrifugal. So once this is done, it will take maximum of 10 minutes. We withdraw that plasma with the platelets with 4 ml of 4 to 8 ml of the PRP injection. Then under sterile conditions, after cleaning with the betadine and the spirit solution of the portion, then we, with the sterile conditions, we inject that PRP injection into the joint, either into the knee joint or a shoulder joint or elbow joint, and we'll ask the patient for any reactions or any allergic reactions or any complications are there for that for 10 minutes. If patient is okay with that, then patient can walk around and they can go home. So it's hardly a 10 minutes process, and it is very safe because you are not contaminating with the other kind of a blood. So if you ask for any complication or anything like that, see, we are taking the patient blood and injecting to the patient. So it is very safe, and it's a 10 minutes process, and it's in everything is a closed chamber. So there is no contamination, nothing like that. And we are doing it in a sterile condition. So definitely it is effective, and it's a variable. Like if patient is a smaller patient, smaller joint, you take it just 2 ml of a PRP. If patient requires a larger ml, you take 8 ml of. So it is quantity also, you can vary the things and all. So the PRP definitely helps in many of the situations.
Thank you, doctor. You've for explaining this in very simplified manner and in much detail. So I think this is very understandable for all of us who are not from the medical background, that how easy and how meticulously this is prepared. So, doctor, what kind of orthopedic conditions or injuries can PRP injection help with? So, a lot of listeners are, elderly people who are suffering from age-related issues, arthritis. Some people are suffering from sports-related injuries. So, what kind of orthopedic conditions this can treat, and are there any specific cases where it's particularly very effective?
Yeah, as I said before only, like many tissue healing problems, especially we have osteoarthritis, which is the early part of osteoarthritis, means usually which sets into the 45 to 60 years of age group, where they are not fit for a surgery or they are not into the category of a surgery also, or the disease is not that much progressed where we can advise a surgery directly. But earlier part, they have taken a physiotherapy and a painkiller, but that it didn't give the much of the relief to them. So such candidates, we tell them that PRP injection definitely works and it better works in that condition. And if they take the PRP injection for regular intervals, it should not like one in a year. At least you take one in a month or one in a two in a month. And it in a regular intervals over the period of 1 year, if you take, then definitely it will have a very much effective in controlling as well as preventing and progression of the disease also. And it's a natural healing. So sometimes the patient may not progress at all and they may not require surgery at all. So they may completely heal off. So in knee, if you consider the first condition, what we give is osteoarthritis, early osteoarthritis. And in case of a sports injury, such as some of the ACL tear is there or ACL avulsion is there, where there is just got a lax ACL kind of thing or a lax ligamentous injury or a meniscal injury is there. There also we tend to give the PRP injection. And and if you consider the other portions like such as the shoulder joint, the common shoulder joint problems are the rotator cuff injury, especially in case of the sports people. So in that case it also works better. And in case of the elbow joint is the tennis elbow people, like those patients having a lot of pain in the outer portion of their elbow joint whenever they do the repetitive action or a lifting or sweeping kind of activity, and they will have a lot of pain. So such patients also works well with a PRP injection. And in case of an ankle, as I said, the plantar fasciitis and a calcaneal spur and a tendo Achilles arthropathy, these kind of things also we can give the PRP injection.
Right, right. Thank you so much for sharing that, Doctor. I'm sure that is a lot of help to our listeners who are listening to us. Guys, if you have any questions around this topic, please do mention in the comment section below. So, Doctor, what's the typical process like for a patient receiving a PRP injection from consultation to recovery? So, what is the whole process?
No, process, as I said, when they come early, like when we diagnose them that they are having early osteoarthritis kind of thing, so we already started with the conservative treatment like painkillers, physiotherapy, some of the exercises, the life modifications. So these things will tell them. So if they're still not there, okay with that, they're not recovering, then we'll advise them a PRP injection. So as I said, PRP injection usually you should not take it for only one injection. So better to continue every month or every third month, so that if they take it regular intervals, so whatever the tissue healing or the things which are not progressing that are recovering faster, it will be sustained. So it will be continuously improving upon. So once it improves upon, we need to take it regularly for a 1 year. So, but at an equal intervals. So, and it is just a patient can walk in and it's a 10 minutes process. As I said, hardly takes a 10 minutes and everything is closed chamber. So there is no point of a contamination, neither kind of a reactions, because there is no transmission of any infection or any kind of the cross thing is not involved at all. So everything is a patient's what we are taking the blood and we are separating the things and we are injecting into the patient. So it's a closed chamber, no cross infection, no contamination, and quantity based also. So how much we need, that much only we can inject it, and there is no extrapolation also. So these things will definitely help the patient. So early osteoarthritis is the ideal condition where we give, and even for some of the sports injuries such as the shoulder and the knee problems, also we give the PRP injection, and it works better compared to the steroid injection. So everywhere they give a steroid injection, so the people may feel better for the earlier part of the steroid injection because it's an anti-inflammatory which acts faster. But after some period of a time, again the pain will recur, as well as the patient will have a side effects because the steroid gets systematically absorbed, and that will cause the peptic ulcers, hypertension, late onset of a diabetes, osteoporosis, and the wear and tear may be increased, progressively may be increased. So these problems comes with the steroid. So to avoid the steroid, and we give a natural thing which is a PRP injection, which works better. And there are many evidence-based medicine also where they have studied very well what's the role of a only PRP injection or PRP with a hyaluronic acid and role of a steroid. And what they found is that PRP injection works better compared to the hyaluronic acid and the steroid. And if you give it at a regular interval for a longer period of time.
Right, doctor. Thank you so much for sharing that. So you're right in saying that steroids work better in the earlier stages, but again later on they provide a lot of side
You're right.
effects, and also definitely PRP supports in that. So doctor, now a natural next question comes from listener, and he's asking: are there any risks or potential side effects associated with PRP injections, and how do you address them in case they come?
The first thing is you have to see for any contraindications for to give the PRP injection. Means which patients are ideal. See, if patient is anemic, so their HB is very low, we cannot give the PRP injection. If their platelet count is very much low, there also we cannot give. It is because of either because of a thrombocytopenia, what we say as a idiopathic. We don't know the reason. The platelet count is very less, or they say the dengue where platelet is very less, or they may be having some kind of a cancer related issues where their bone marrow suppression, where there is a cell generation is not occurring. Those who are chronic alcoholic or tobacco induced, where there is a bone marrow depression, where the cells count will be definitely will be low. So such patient will not be this one. And what some of the kind of a blood related infection or a sepsis kind of a thing, such patient also we cannot take for the PRP injection. So if you consider the complication, if you don't do it in a proper sterile condition, then the chances of a contamination may be high. So that's what we take the patient to the OT, and in aseptic precaution, we withdraw the 20 to 25 ml of a blood in a proper condition, and the company has provided the kit. In that kit only we need to inject it. We should not separate and keep it in a fridge or something like that and later use it. Instantly you take it, then keep it in a kit and centrifuge it. And there is no touching of the blood at all. There is no mismatching or a cross matching or contamination, as it is completely closed chamber. And all the technician and doctors are doing this with wearing the gloves and safety conditions. So hence there is a less chances of infection also. But if you don't give in a proper manner, then as you are injured, may inject some kind of a sepsis or some kind of infection into the joint also. So it has to be done by properly by the orthopedic surgeon who knows about it under aseptic conditions in a OT, so that patient will not have other problem. Some people may get allergic reactions in the form of a swelling, kind of a redness or a fever, or some allergic dermatitis or some kind of a itching over the body or a sweating, or suddenly there may be a swelling because if it has not given in a proper condition, or some neurovascular injury may also happen if the person doesn't know about which site we need to inject and how to inject and which way to inject. If you inject it in a wrong manner, you may damage the arteries or the nerves around it. So these problems are associated with the PRP. If it is done by a expert, it works very well in an expert hand and in a aseptic condition.
So, guys, it's very clear, as Dr. Deepak said, get it done through a professional expert doctor and don't risk it with someone who's new, who's not that professional. Doctor, let's talk about supplements like glucosamine. Are they commonly recommended alongside PRP treatments, or how do they complement each other?
Actually, they have started giving this rejoint and all. So these all contains nothing but the cartilage supplements. So usually the cartilage is a kind of thing. Once it is damaged, it won't recover faster. Even it heals also, it heals not in a normal manner. It will heals in a scar formation kind of thing. Normally we have a hyaline cartilage, but once it damages and it heals, it become a fibrocartilage. So which is not a natural cartilage there. So we add supplements so that they may recover faster. So earlier these
It seems there is some network issue with the doctor, so let us wait for him to join in. In the meanwhile, guys, this has been a fabulous topic and a lot of questions coming in from all of you around PRP. What exactly is PRP? How this is useful? One of my friends, relatives, they underwent this. How safe is that? And when should we approach for a PRP? I believe the doctor is back. Let's get him back for the discussion. Yeah, welcome back, doctor. Yeah,
Sorry for the interruption. Yeah, sorry for the interruption because maybe the
no,
internet issue.
no
As I
worries.
was saying, yeah, yeah, that supplements, you can use the supplements, but already they found with injection of cartilage will not be as natural as with a PRP injection. So if they are okay with that, they can continue the supplement. So, but along with the PRP injection, it may complement or it may help, but in the longer run, it will not help complete regeneration of the cartilage with the PRP works, PRP heals, and faster than the.
Yeah, it seems there is an internet issue with the doctor. No worries. I believe he is back now. Yeah, and he's here. Yeah, doctor,
Yeah,
please continue.
yes, Rahul. Yeah, glucosamine supplement, as I was saying, you can use it, but it will not help in a longer run. So you can just add it to complement the benefits of the PRP. But if you see, the PRP works very well compared to the glucosamine. So rather than taking the tablets for the longer duration of the time, it works in the expert's hand.
Understood, doctor. So, doctor, do patients who receive PRP injections require any special braces or supports during their recovery? How does this impact their healing process?
No, actually, it doesn't. It's just a matter of a simple injection. What we give intramuscular injection, that kind of injection only. Neither we open it, neither we do anything. Just we clean the part and give the injection. And after that, they can move the joints as well, so that whatever PRP we injected, it will get distributed all around the joint. And whenever there is a damage, that portion only the platelets will go, and they will stick to that portion, and they will release the granules and they start the healing process. So as such, we don't advise to use any braces or any support or anything like that, and they can walk around if they're able to walk and all, but do the physiotherapy, do the basic exercises, so that that will strengthen the muscles, strengthen the ligaments around the joint, and it will improve the lubrications of the joint as well. So we don't advise the braces for the after PRP injection.
Right. So usually a patient need not have braces, and in any conditions you would recommend them to have braces for any particular injury or any particular.
Usually, what happens if there is acute injury? In case of acute injury where there is a when we taken the X-ray and all, we came to know that there is no fracture. It's just a ligamentous tear or a sprain kind of thing, where it's just a stretching of the ligaments or the muscles around it. There will be some kind of bleeding or a bruise and some kind of swelling will be there. In that case, we ask the patient not to walk for 1 week, keep the limb elevation, use the ice pack, and use some of the braces while walking and all. And in acute cases, we don't advise to give a PRP injection. Once this acute stage sets off, then patient recovers from the basic injury. Then we ask them to walk and all, but still they got a pain. In that case, we advise the PRP injection. So, but in the acute injury, definitely they need to use the braces, use the assistive devices for walking and all. And once it's settled, then only take the PRP injection. Don't take in the conditions.
So we have a very interesting question coming in from a listener, doctor. He says that for someone who is considering PRP treatment, what should they expect in terms of pain or discomfort during or after the injection?
Yeah, that is what I was saying. The PRP works in all around.
Hmm. Okay, it seems there is an internet issue with the doctor. He'll be back very, very soon. So, guys, now we are talking about PRP. We are with Dr. Deepak, who is an orthopedic surgeon at Devidas Hospital. He's back now. Yeah. Yes, doctor.
See, as I said in my the start of the talk only, the platelet. So it works on the cartilage, it works on the synovial side, it works on the inflammation part also. So it everything. So definitely relief compared to the tablets of NSAIDs or some kind of glucosamine kind of stuff. And it will take part of the pain, it will take part of the healing, and it will take part of the progression of the disease. So it works in three ways. So hence, better recovery, faster recovery, and in a safer manner, and in a natural manner. So, but we need to sustain it. So we cannot give one shot and leave it. We need to give an injection in a regular intervals over the period, right? So that the whatever tissue healing started, it has to continue and complete. It should get complete. In that manner, the patient definitely will get a pain relief with the PRP injection. In addition to that, they may take some of the painkillers also, but definitely one PRP injection works for the pain as well as tissue healing.
Right, right. Thank you for sharing that, doctor. So another question coming in from a listener is that I'm undergoing PRP injection for one of my sports injury issues. Are there any lifestyle changes or precautions that I need to take before or after getting PRP injection to maximize its effectiveness?
As I said, so while we give a PRP injection, we don't advise that of using of a braces and all, but recovering of the chronic injury, when PRP starts work tissue healing also, we need to sustain it. So in that manner, they should not go for a faster like a return to the basic sports manner kind of thing, but they should do the physiotherapy where that will strengthen the muscles, strengthen the ligaments, and improve the lubrications of the joint and all. So that will not cause the stiffness kind of a thing. So they can walk around and all, but they should not do the heavy activity or a sports level of activity where it will again disrupt, again repetitively injure the tissues.
Yeah.
So in that manner, we advise them once they take a PRP injection, better get on the physiotherapy and the basic things, but don't indulge into the major sports activities.
Understood, doctor. So, doctor, a last question of the day coming in from another listener who wants to ask about. So, for someone who is considering the PRP treatment, what are the key factors that people choose PRP as a popular choice? What are the potential benefits for people as compared to the
Say,
other?
how people choose like the robotics or computer assisted surgery as superior to the basic surgery kind of thing. The similar manner, the PRP works better compared to the basic kind of a treatment such as a painkiller, physiotherapy, or kind of a braces, this kind of a treatment. So hence they should choose the PRP as the kind of a treatment when once they are not recovering from that chronic sort of injury or a chronic injury which is has got a tissue healing problems in the area of the body where I said like shoulder, knee, and ankle kind of a thing. So they should consider the PRP. They should give a chance to the PRP. So it works very well in the experts, and in our Devadas hospital, we do regularly the PRP injections for the early osteoarthritis of the knee joints in the age group of 45 to 60, which works very well. And patient comes and asks for the stem cell therapy also. They say that are you giving a stem cell therapy for some kind of other injuries or some kind of things and all. So we usually use the bone grafting kind of thing or the bone morphogenic proteins and a BMAC injections for the fracture healing also, where fracture is not uniting. They underwent the surgery outside, but they keep on coming that fracture is not uniting, sir, and all. We use a regular treatment such as a bone grafting, BMAC injection, bone morphogenic injection, bone marrow injections into the fracture area, which will heal faster. And similar to that, we give a PRP injections where they got an earlier knee pains or ankle pain, shoulder pain, and all. And if they are doing all of these, and those who are progressed very fast, in our hospital we have a fully automatic robotic knee surgery also, where we ask them to undergo that robotic knee surgery, where there will be the cut of the robotic will be precise, accurate, and there is very small of the joint, so they will have a faster recovery, faster healing, and they return to their daily activities very fast. So we advise them to visit the Devdas hospital and ask more about the PRP injection if they are still in a doubt, or if they want more information about it. Definitely, we are happy to help them and happy to treat them.
Thank you so much for sharing that, Doctor. And it has been a wonderful session. I'm sure a lot of help for all our listeners. So, guys who have been joining us, thank you so much for joining us. And, Doctor, thank you for sharing so much insights for us. We wish you a very, very happy weekend, Doctor. Thank you so much.
Thank you, Rahul, and thank you for the Cureka team and Satish sir for giving this opportunity. And maybe the next month we'll take up the more interesting topic, and we'll again indulge into the discussion. And we're happy to take the questionnaires from the listeners and have a more interaction session. Thank you, Rahul.
Sure. Thank you so much, Doctor. Yeah. So, guys, thank you so much for joining us today. This was Dr. Deepak, Orthopedic Surgeon at prestigious Devdas Hospital in Madurai. So, guys, we have got number of questions coming in from you, where you ask a number of queries around your health concerns on our WhatsApp platform on Cureka.com. If you are new to Cureka, please log into www.cureka.com and you will find a WhatsApp column there. The entire portal website is having a lot of healthcare products. All these products are carefully handpicked by a team of expert doctors led by Dr. Hema Satish and Dr. Satish Devdas. And you can pick and choose any product, completely trusting that these products are recommended by doctors, whether it is related to your skin care, your hair care, nutrition, wellness, any herbal and Ayurveda treatment, or whether it is elderly care, wellness, or a sexual wellness product. And in case you are not sure which product is best suited for you, we have got a free of cost WhatsApp platform where you can connect with our healthcare experts, ask them about your query, and we will give you the response for free about what products are best recommended for you. You can get it, purchase those products from anywhere you want. You want to buy from Cureka, most welcome. We are more than happy to serve you. Also, guys who are in Indiranagar, Bangalore, we have got a retail store in Indiranagar, very near to you, in 12th Main, behind ICCI Bank. So, if give us a chance and meet us there. Our wonderful team there is doing a fabulous job at meeting people. And let us know how's your feedback. How do you like the store? If you want something very specific in your store, we are more than happy to help you. Thank you so much. This is Rahul Nanuhal signing off for today. Have a very, very happy weekend, guys. Thank you so much.